The much extolled public healthcare system in Kerala is now under scrutiny. This is after the head of the urology department at Government Medical College, Thiruvananthapuram, came out with a shocking revelation. In a Facebook post, Dr. Harris Chirakkal, who heads the urology department at Thiruvananthapuram Medical College, said there was acute shortage of medicine and equipment in his department. He said that was forcing doctors to postpone surgeries, which is causing serious discomfort to patients. Initially, the left government ignored the statement. The doctor, who is a well-known fellow passenger of the left, he made the revelation as he was frustrated. He was frustrated with the systemic failure. He was frustrated with the bureaucratic bottlenecks. Many times he prayed and petitioned, but there was no result. So that was the reason why he made a post in the Facebook. He said he didn't think that is going to create a furore in the state, but actually it kicked up a political storm. Though the left was initially on the back foot, later on they become very aggressive, and despite the complainant being their own sympathizer or fellow passenger, they have come out even against him. Dr. Harris Chirakkal is known for his honesty, known for his diligent work culture, known for his commitment, and he is accepted or praised for working conscientiously. So even such a person has came under attack from the left. Now, what could be the reason why the left changed tack? There is a reason for it. It is because the left always highlights Kerala model, and Kerala model bases itself on the development in the healthcare sector and educational sector. Actually, the progress recorded by the state in healthcare as well as in education is not the result of the work of left movement in Kerala. So then who laid the foundation for the progress of the state in those sectors? Let's take a closer look into the whole situation, and let's try to reveal the truth. Welcome to Insights. I am Hari Kumar. Let me start from the latest incident. As I said, it was a Facebook post of Professor Harris Chirakkal, who heads the urology department of Thiruvananthapuram Medical College, that kicked up this storm. He said he had complained to the authorities. He had brought the whole issue before the attention of the state government several times, but that were of no avail. And the situation continued to be like that. And eventually, he got so frustrated that he put a post on the Facebook, and many people read it. Initially, as I said, the government tried to ignore it and said he might not have taken into account of the whole situation. And as the regular refrain of the government in such issues is, this is an exception. This is not the norm. But though the doctor was on the back foot later, he went on an apologetic mood. He said what he said was correct, but the way he put it may not be right. That was his eventual conclusion. But the left is not satisfied with that, because as I said, the left's propaganda in Kerala bases on the, achievements on healthcare as well as education front. Actually, if you look into the basic into the whole sector, we find that the basis for all the progress achieved by the state in both those sectors were laid by Travancore kings. Since now the controversy is regarding the the healthcare sector, let us focus on that. Even in 1813, as you look, it is almost more than 200 years ago. Even then, the Travancore kings were very much aware of the need to focus on healthcare front. In 1813, the Travancore kings implemented vaccination against smallpox in the state. People were afraid to take vaccination those days, and to pressurize them or to convince them, the royal family members of Travancore took vaccination themselves, and they set the example. And there are many such examples, initiatives taken by Travancore kings later. They encouraged people to start many hospitals. Then the work of Christian missionaries also needs to be mentioned. So I think the LMS, the London Missionary Society, was one example. Then there were other groups also. So even the Travancore kings were very particular to collect data on various health problems that existed in the state. For example, they collected data on filariasis patients, then about other health issues, and the government was very much concerned. They started public health department in 1900, early part of 1900s. Then again, even before that, by 1890s, the Travancore kings started a sanitary department. So they were very particular about. They introduced Western medicine in Kerala. They even appointed representatives of Rockefeller Foundation as advisors in Kerala. You cannot even imagine nowadays that those rulers were such far-sighted. So the progress. No, even I failed to mention about the beginning of PHCs, public primary health centers in Kerala, and that was also done during that. To study about that, they sent somebody to England, and after working there and studying there for more than a year, that doctor came back and he started primary health centers in Kerala. So such were the initiatives. If you look at like at Thiruvananthapuram Medical College, the idea of that was mooted by Travancore kings, and later it was implemented when I think that was in 1951. Even before the formation of state Trivandrum, Thiruvananthapuram Medical College was formed. It was Tirukochi state then. So if we are to give the credit for the progress in public health sector in Kerala, definitely the Travancore kings royal family merits it. I am not a worshipper of Travancore royal family, but still I cannot ignore their contributions on those sectors. Now the left movement, they realize that the state has made many achievements on those fronts in the healthcare sector. So what they did, that they usurped, they claimed the credit for all those achievements. And since the left has got a very powerful propaganda machinery, and the so-called intellectuals and academia of the state are their supporters, they succeeded in convincing even the people of Kerala that it was the left movement that laid the foundation for the progress of healthcare sector in the state. And many people inside Kerala and outside the state, they believe that, and people think that it is the left movement in the state that is primarily responsible for the progress on healthcare front. So that is why the left gets very irritated. They go all out to attack those who point out the truth. So here also that happened. Now I think the fate of the doctor is sealed. Even though he was a fellow traveler of the left movement, the left is not going to forgive him. He will have to face his nemesis sooner or later. So this is the situation, you know. So that is why the left is so much irritated. There was no need for them to, personally attack the doctor. They could have just corrected the things that he pointed out, because it would only bring fame to the or credit to the present government. But they didn't do that, because that would mean that the left has accepted the weakness or handicaps in the system. If you look at the handicaps in the system, after the doctor pointed out the shortcomings at Thiruvananthapuram Medical College, many media houses have published news reports on the pathetic situation in government hospitals in Kerala. They say that dues to the tune of rupees 2,200 crores is there. The state government is yet to clear the debt of rupees 2,200 crore to drug manufacturers and manufacturers of medical equipment. And because of that, they are unwilling to supply medicines and equipment to government hospitals in Kerala. And the eventual result is that patients suffer. The average people, the common man in the state depends on government hospitals. You need to remember that even a communist like, self-proclaimed communist like Chief Minister Pinarayi Vijayan does not go to Thiruvananthapuram Medical College to seek treatment. The ministers, political leaders, etc. from the state, they go to, hospitals in the United States and the UK for treatment. Mr. Pinarayi Vijayan regularly goes to Mayo Clinic in the United States. That is not acceptable to, that is not affordable to the common man in the state. He has to depend on, the government hospitals. He cannot even depend on the private hospitals in the state. And for them, the pathetic situation or the systemic fault in government hospitals in Kerala is a nightmare. Where will they go? There is a health insurance instituted by Kerala government named Karunya, and that is also not functioning properly, because the government is not paying dues which it owes to drug suppliers. So they are unwilling to supply drugs because they are not sure when the government is going to clear the dues. So this is the situation. But still, the left will, through their propaganda machinery, they will, blame the doctor for being, a spokesperson for their opponents. So this is but because of the power of the propaganda machinery, people may think that what the left say, what they say is the right, is truth. But the reality is totally different. So this is the situation. The much extolled healthcare sector of Kerala is not as perfect or as efficient as many people would like to believe. There is the whole system has failed. This is the truth. I will be back with updates. Till then, goodbye.